Hello everyone! Welcome to Medical Veteran Podcast. My name is Avia and I'm here with my friend.
Hello everyone, my name is Amanda.
We are a second-year medical student here in University of Pembangunan Nasional Veteran Jakarta. And we will be hosting today's podcast for 30 minutes ahead.
And we are very excited today because we have our special guest here, Miss Geraldine and Miss Joyce from Maastricht University. Hello Miss Geraldine and Miss Joyce.
Hello.
Hello.
It's a pleasure to have you guys with us. It's very nice to have you here. Can you please introduce yourself more to our audience there?
You start.
I'll start. Hi, I'm Joyce Grul. I'm from the Netherlands and I'm actually a Maastricht University alumni. A bit shorter ago than Geraldine. And now I've been working there for over 3 years at the School of Health Professions Education.
Wow.
Interesting. Maastricht alumni.
Okay.
And this is a second Maastricht alumni. I have also studied medicine in Maastricht, but way back then, only the 10th batch of our university, so new program at that time. And I'm still working in Maastricht University, but now as a teacher and as an international officer.
Oh, so Miss Geraldine here is both an alumni and also the lecturer there,
yeah.
right?
Right.
Okay, that's quite interesting. And we are very honored to have you both here. Thank you in advance for sparing your time here with us.
And thank you for having us here. And I have never been interviewed by two medical students who look so professional as presenters.
Oh,
my
wow,
God,
thank
thank
you.
you.
We're so excited because we're so excited. How are you? Have you had your breakfast?
Yes, sure.
And
we
lunch.
are taken care of very well here.
So you're ready for today's podcast?
More than ready.
Very ready.
Is this your first time coming here to Indonesia or have you been here before?
For me, it's my first time.
It's your first time.
And for me, I have been in many times, but the third time here in your university.
Oh, so you've been familiar with Indonesia?
A little, yes.
A little. So how long have you been here? For like Tuesday? How many days have you been here?
Well, we came in on Sunday. Last Sunday, so we are now here for 6
Six
5
days.
days.
It's difficult to keep counting because the days are very intense and we have a 6-hour time difference with Maastricht, with the Netherlands. So sometimes I'm confused which day it is.
Okay.
Confusion, yeah, like coming to new country.
Yeah, and especially because time is intense. You work hard with the staff here. You prepare in the evenings the next day.
Oh.
You try to sleep, but then when you go to bed, it's like in the Netherlands time to get up.
Oh, yeah.
Oh.
So it's all mixed up. But we love it very much to be here and to be consulted and to hopefully be of use in the development of your problem-based learning system here.
Oh, yes, we're going to talk about problem-based learning too here.
Yeah, so how is your impression here? You have been here for quite some days, right? Do you like it here in Jakarta, especially in our university?
Yeah, I think I can speak for both of us if I say we like it a lot and we've had a very warm welcome, and we also had the pleasure of learning more about your staff members and their expertise, and they're super committed to this program and education. And then yesterday we even got to meet more medical students who were also very committed, and we had a very good session together.
Oh, yesterday's session for tutorials, right? Yes, I've seen quite a few of it. How has been the most memorable experience that you had in here?
Oh, that's difficult to pick. I think today is what I'm enjoying the most because we've had all these intense days with workshops, and we've talked about a lot of different topics that now needed to be applied. And it was really nice to see the staff members applying it in our workshop, but then also asking the follow-up questions about what's next, which I'm really excited about, that they're looking to the next steps.
Oh, so you're very excited for today's podcast because it has been busy days for the past few days, right?
Yes. Besides that, what are other activities that you've been doing here in the past few days in our university? Can you tell a brief about your activities in here?
None. There are no other activities,
there are no
then
other.
workshopping, preparing the workshop, trying to sleep and workshopping. And that is why we're here for. So that is not a complaint. We love it the way. And what we especially like is that we are doing a workshop in the literally sense. So people work. And your staff members really work hard and they follow. Sometimes maybe the assignment seems a bit like, why do we need to do this?
Oh.
But your staff is willing to participate, and we appreciate that very much. And for us, it is an opportunity to explain a concept or an educational method that we cannot explain by just talking about PowerPoint presentations.
So it's very various kind of presentation that you have to present to people here in order to send the message.
Yeah, in different formats. So I think out of the 5 days that we are now working together, maybe they had the time to sit down in a chair at a table for half of the time, and all the other time they move around the room, they do exercises, they have to join discussions in smaller groups, they go to the flip over, they even do some copy paste work. Well, a lot of activity really, so work to make it stick to the mind, not only by explanation and that you think you understand, but by doing it and you feel what it means. So it is experience-based learning.
Oh, so
experience-based
learning. So you wish to see more exploration, actions rather than just presentation, right?
Yes, that is in the end the competency that we are trying to help to establish or to develop, because a competency is not only knowledge, it is also that you can apply it, and that you can apply it in the right setting at the right time. And that is complex, that's not easy. For medical students the same, in the year 1 and 2 maybe you are more learning about the theory, but in the end you need to be in the hospital and work in a way that really is impactful, that helps. And knowing a lot is important, but it does not automatically help the patient if you don't know how to communicate, if you don't know how to discuss your patient case with other professionals. There are so many other things you need to do to make the knowledge of use. So that is what we call competencies. And we do that now with your teaching staff in educational competencies, and you do that as medical students in other competencies like communication skills or collaborative skills or leadership skills and so on.
So you're talking about it's not just theory, but how you communicate it with people, the activities going to the people. I would like to know, I'm really curious about the learning activities in Maastricht University in medical. Can you tell us a brief about it?
We've got also problem-based learning in which it's very integrated, so you don't have a block on just anatomy or just physiology, but it's all combined in one. And then we've got tutorials. As medical students, you've got twice a week tutorials, you've got skills lab, you've got anatomy practice classes specifically, you've got communication and reflection, in which you practice with simulation patients and how to communicate, and then you reflect on that within your group. You've got a mentor, you need to keep a portfolio. I think that's Prescribe, which is about pharmaceuticals, and we've got health ethics and law as a course.
Scientific reading and writing. Well, a lot of different topics, and I'm sure you will have them also. Maybe the difference is that we integrate it in the block system that we have.
Block system.
So we don't do a subject and then have an exam and then close the subject, but we continue with all the subjects in an integrated way and apply it to the block content. So if it is about ethics and you are in a block about internal medicine, you might talk about euthanasia and the difficulty and how you approach patients and their family, but to learn to apply it and not only to learn about what is it in theory.
Oh, so for the assessment, you usually like combine it both with bioethics and internal medicine?
True, not only for assessment, but especially in the teaching, in the educational program already it is integrated.
How long does one block take times usually?
Usually in the undergraduate, so the first 3 years of medicine, a block takes 8 weeks.
8
8 weeks.
Oh.
And we have shorter blocks as well. Sometimes it's an elective, so that the students can choose the topic
Oh,
themselves.
elective, okay.
Yeah. And in the master phase, so the co-as phase, we have longer periods. It's about 16 weeks, 10 to 16 weeks periods in different topics.
So at the end of the block, you have like examination week, yes?
At the end of the block, we have examination, but also at the end of the year. So it's not only the end of the block that counts, but also the total. Because we don't want students to close the block and then never think about it back again, because you need it in the end when you graduate. So we need to repeat and repeat and repeat. And so there is not only an end of the block, but there is also some tests that you do at the end of the year, and even at the end of the 3 years, the bachelor phase, or the 3 years, the master phase, there is a kind of exam. Not a knowledge exam, but an integrated exam, and we call that portfolio.
Portfolio.
Okay, it's essential for reviewing the materials because it's very you need it when you become a doctor, maybe.
We need to
That's for
refresh the
sure.
knowledge.
Exactly,
Yes.
and you need to understand, and that is what we feel is our important task to help the students with, to understand how you can learn the best yourself as a student, because later when you graduate and you are in practice, you still continue learning. You need to learn because everything is changing fast. So what they teach you now here maybe is not any more useful after, say, 6-7 years when you graduate. So you need to learn yourself. You need to find a system how you can learn lifelong. And that is not easy at all. It is much easier if the teacher says, from this book, you read now chapter 2 and 3, I give you a test, and then you pass it, and then we continue. That is very easy. But life is not that easy. So we want to prepare our students already for that phase in their lives, that we are not there anymore, and that there's nobody telling you to read chapter 2 and 3. But
Very
you
true.
still need to come prepared to help your patient or whatever job you in the end up with.
So let me take a brief. Like, you've had 2 exams every 8 weeks, and at the end of the year, I'm curious about the examination process, the system there. How is the examination there? Is this like
it's a bit complex to explain in a nutshell. I think what is most important to understand, and help me if because Joyce has the more recent experience. What is the most important to understand is that we have a lot of informal tools to give students feedback. So it's not really assessing whether you pass or fail, but it is a way to give you information about how are you doing, how are you developing. And that doesn't lead to a conclusion like, okay, you failed, you have to redo the exam, but it leads to a conclusion like, you are not yet at the level we want you to be. What can you now exercise better or rehearse more to get to that level? And we have a conversation with each student individually, the mentor has, to help the student to see, okay, my anatomy, I think it's not so well. Let me now go more often to the dissection room. Let me maybe do a self-test. On internet you can find so many self-tests. And show myself first that my anatomy is improved. Later it is important for the teachers also to understand that your level improved, but first and foremost it is for the students to understand what is my weakness, how can I repair it, and how can I prove that I really increased, that I've improved. And if you know that kind of approach, you can use that also after graduation, of course.
And what is important to note here with is that that's very true, but there's still a minimal amount of knowledge or skills or integration that we need to have. So it's not like that every time you don't pass an exam or an assignment, that it's like, oh, you need to tell us how you will improve, and it's all right. There's still, for exams and for certain assignments, you need to have at least a voldoende? Sufficient to pass. And also, if you don't have enough sufficiency within 1 year, then you don't go to year 2, then you need to go back to the start of the first year or do certain blocks. So it's that you still need a minimum amount of knowledge and skills before you can pass on to the next. But you get a lot of information on how to do that from those informal moments. And for example, in year 3, we're going for the first time to the hospital and we see a real patient, and you want to be able to perform there well. You want to communicate well with the student. You want to show that you've got your skills. So that also means that students are often very motivated because they've got this moment where they already want to show how much they can do.
So when it comes to assessment, the students also have to go to the patients directly and, applying the knowledges that they learned in university. That's very interesting. I would like to have that too in our university.
Yeah.
Thank you so much.
And can I ask, is there any computer-based task or like clinical presentation from the students there to the examiner?
Yes, but first you don't do that to an examiner. You would practice to give clinical presentations to your peers.
Your
And there
peers,
is a tutor who gives you feedback, whether you did it well or not so well, clear, nice summary, good interaction, and so on. Content-wise feedback, whether you say something that is incorrect, then it will be corrected, but it's not really graded. You need to practice. And in the hospital setting, or in any workplace, also in the Puskusmas, we have also a system that is quite similar to Puskusmas. Students do the same, but that feels more real because it is not anymore in the school. It is in front of a real clinician or a real family physician. And then later we do it for assessment. So it's not only and immediately for assessment.
So it's basically the learning activities going in there, not just for a task like that.
Yes, because you can learn from it, and if you get feedback, you can next time improve, and you know maybe better what to improve. And only if you did that many times, then we think it's time to assess. And then exactly like Joyce said, then it is for real, I would say. If you are insufficient, you have to repeat. That is also in our system. But it is not so much assessment driven, I believe, as I can see that it is in Indonesia as a whole and here as well. And we don't have so much competition among the students. It's not who's the best, but it is, are we all getting there? Can I help you to get there? So it's because we know that in real practice, you work together with other professionals.
We help each other.
Exactly. You have to learn how to collaborate and not to compete.
Right. Collaborate, not
over competition, right?
Yes.
Okay, so we're really excited to know more about Maastricht University, and can you tell what are the challenges that medical students or lecturers usually face in daily basis, and how do you overcome that challenges?
Okay, this question we can talk a month about what challenges.
That's a lot to us.
We also have enormous amount of challenges. Don't worry, it is happening everywhere.
Very common.
Maybe if I can point out one of them, I think as a starting student in the Netherlands, usually students go live by themselves, but that's becoming less and less as well. But you suddenly go from high school to university to a problem-based learning environment where you become responsible for your own learning. And we've got only 12 hours of education a week, and all the rest of the time is for self-study. So what we really quickly need to learn is how to do self-study, but also that if we haven't studied before a tutorial, then we don't get out of the tutorial what we need.
So true.
And if you're not participating, the tutorial is also not fun for your fellow students, because the more you've prepared and the more questions you came up with and the more perspectives you bring to the table, the more discussion you have, which facilitates learning, because if you can explain something to another person, then you've really understood it. But it also makes it very fun, because especially also at this table, all four of us have different perspectives, different experiences, and we can learn from that, but only if we bring that to the tutorial. And we also sometimes have the challenge that students need to figure that out and then start applying it. And some students, they're hard to motivate, but at the end, they need to do it for themselves because they want to become doctors.
True. So I have one last question, okay? We had something that we complain commonly. It's about student oral case analysis. That is a clinical presentation that you are going to be graded about. Do you think that kind of examination is effective to like grade, to assess the students' capability?
Mm-hmm. Yeah, I think it always helps. As long as you don't rely on one type of assessment, you mix assessment methods, because only one type gives you information about one part of the knowledge and the experience of a student, and not another part. And if I'm now going to use this all the time, I'm testing only maybe half the student.
True.
If you understand what I mean. So I think it is effective, and in real life, it can happen that you even need to do this, not in an exam format, but you have to explain in front of your colleague what you think about this patient, how you analyze this patient, and so on, in an understandable way. So it's good to practice that, but it should not be the only way to be assessed.
So true. So it's to help us collaborate with our colleagues and also help us to like present the case with the patient's family.
And also the communication skills.
The communication skill.
Yeah, exactly. And that is why I think it would be nice, I don't know if that is happening in your case, but if you also get feedback about the other elements. So not only about your knowledge, whether it was true or wrong what you discussed, but also how did you do it? How did you interact with the person, in this case the examiner then, in front of you? Because that can help you in future to be more understandable for your future colleagues or patients even.
True. So we've talked a lot about student-centered learning, problem-based learning, about lab activities. We also talked about that, and we also discussed about clinical presentation as examination. And I think that's it for today. It's very nice to have both of you here, Miss Geraldine and Miss Joyce.
We would like to thank you again for coming and visiting our university. I hope you will get many great experience here in our university and also in Indonesia.
Oh, before we close this podcast, do any of you has like a closing statement, like messages or feedbacks for us? For the audience also.
Yeah, for the audience also.
I think just that we really enjoy already being here and that those great experiences has already happened, and that we've also very much enjoyed getting to know you, and thank you for asking us those questions and being interested in how education works.
Thank you. Okay. Thank you too.
And if I may add a little,
I think sure.
What I would like to thank the school for is inviting us, but also to compliment them on the way they take education serious. A school, a university is about education and research, and often research gets most of the attention, while I think education is equally important, and this school shows that they pay a lot of attention to education, so that is, you can be proud to be a student here.
Okay, thank you so much, Miss Geraldine and Miss Joyce.
Can I add a little?
Oh, sure.
Okay, because maybe audience here or medical students here are interested to know more about Maastricht. Does Maastricht University have like an exchange program or visiting program for overseas students? Can you maybe tell a little about it?
We have, and I will tell you a little bit outside this broadcast.
Okay.
I'll share you some websites and email connections. Okay.
So maybe for the audience, you can check out your official website for knowing more about the program.
Okay. So, see you next time, and thank you so much, Miss Geraldine and Miss Joyce.
Have a nice day.
Bye.